Hi, I'm Dr. Eisenmann.
And I'm Dr. Charlene Gaudet.
And we are the practitioners at Resiliency Brain Health. And today we are going to talk about that we are portal of entry clinic. We are portal of entry practitioners and what that means for your healthcare. And I think this is actually really important. Maybe it's not a clickable topic that you think right away that you need to actually learn about, but if you are functionally curious or functional curious online and you're kind of going in and out as to trying to understand this world of functional neurology, functional medicine, bioidentical dentists, like everything is functional nowadays. This is a great topic for you to kind of listen to. This is a great video to send to a loved one that may need to learn more or is looking for more information on these. But we want for people to understand that in a functional clinic like ours, we are portal of entry. And what does that mean? It means that you don't need a referral to come in. That is something we hear a lot.
Right.
It's like, do I need to be referred to go to your clinic? No, actually. And we can be used as yearly physicals too. Actually, you know what? This is a great time to talk about why should people actually check their brains once a year?
Yes. So you can get a referral. You can ask your provider. You can talk to them, say that you're thinking about going to this. Or you can call and say, hey, listen, I want to self-refer. And that's okay too. So we are portal of entry. We will see all of that. But as far as the brain goes,
yes,
right, we do, dentists have done a great job with saying, hey, you need to check your teeth twice a year, right? We need to come in and handle that. And that's great for the body's health, for the brain's health, right? The teeth make a big impact on how the brain functions. And your, practitioners in the past have said, hey, let's do lab work once a year, especially if you're female, right? We go in for our annual exams and have our metabolic systems checked. But as far as our brains, most of us don't think about it, right? It's there and we're not going to think about it until it's just not working.
Yeah.
But our whole goal is, as functional providers, is to prevent pathology, right? So we want to be proactive instead of reactive, and we want to see if we can keep that brain healthy, keep it functioning, and at the first signs that things aren't functioning the way you want, it's not that you need to wait until you can't remember your telephone number or you can't remember how to, drive to the store anymore. You can get that taken care of long before that becomes that issue.
Yeah. And rest assured, if we need to make a referral, we will.
Yes.
Because, we don't have the answers to everything, but we can definitely help you out to see what answers you're searching for when you go to a functional clinic and you're trying to look to see, should my approach be more lifestyle driven? I had a patient actually recently that brought that up, and I thought that was curious. He said, I thought that I was only going to manage my concussion symptoms with lifestyle, like nutrition and just exercise. Is it true that I need more? Right. So that was wonderful for him because we were able to check and see where he was at in his functioning, what that meant for him, and how does that apply to his personal life and his goals. And he decided that he wanted to do a little bit more therapy rather than just the nutrition and exercise. Those are invaluable, by the way, for brain health. So once again, it's no competition on like who gets the patient or who gets the business. We should all, really.
Right.
It's all encompassing. But really understanding that just because your brain is in your head, and as you say famously, the brain has no pain receptors that we know of right now. Then there's going to be a research paper that pops out and says otherwise. But really, we don't think about it. I mean, how many of you are probably going to bed at times you probably shouldn't, dysregulating your blood sugar and really hampering your brain health, unknowingly exposing yourself to products and different environmental toxins that may be neurotoxic,
right?
And you don't even realize it. And how many of you have been in a motor vehicle accident, had sports-related injuries, or just been a person, really, and fallen, and maybe haven't recovered as well, but we pitch those things to the side.
Right.
We just, oh, that was kind of weird. Oh, yeah, I tend to hit my shoulder on the wall. It's just because I'm clumsy. And so we make a lot of excuses as to why we don't function appropriately.
Well, and sometimes it is, you did have an accident, but you didn't have a concussion.
Yeah.
But things just don't work right still.
Yeah.
Right? So there is something going on, and it's something worth exploring before it becomes that issue, that process that does need attention.
And how much better, it's not like believe it or not, we have actually had a patient before or patients before come and say like, do I need more help? And we say, no, you're good.
Mm-hmm. Absolutely.
You can be good, but you're not going to know unless you look.
Right.
And you look at your function. So what is that function? Could be eye movement tracking. Eye movements are incredibly important, and we can dive deeper into that in another video. But can you look at a target? Can you pursue a target? Your balance, that is now encompassing your eyes, your vestibular system, your joint mechanics. So for those people that have ankle injuries, knee injuries, those are things you want to look into.
Stub your toe often.
Yeah, stub your toe often. And then we have cognitive as well. So reaction time, memory, psychomotor speed, cognitive flexibility, and
Which means what?
Which one?
Cognitive flexibility.
Oh, cognitive flexibility. We're pretty good at that, I think.
Okay.
And
multitasking. It means multitasking.
If we're speaking together and then he comes in and interjects me, I have to literally cognitively be flexible and look at him, interpret everything he's saying, match his tone, match his voice, and then revert back here.
Right.
So it's a lot. Task switching is a lot. But a very understated one, because a lot of people don't understand that we're also chiropractors.
Yes.
Is range of motion.
Yes.
Your spine is very important. And people don't realize that the less your spine moves, the more dependent you are on other people.
Right.
And
your grandparents are a great example of that, right? Mm-hmm. Has anyone ever been in the car with their grandparents driving who couldn't turn their head and had to turn their whole body, and you were scared? You were really worried whether you were going to be safe in this ride, right?
Yeah.
And so that's a very good example of how a decreased function in the spine creates challenges in the brain.
Yeah.
So.
And we all know kind of what that feels like. We get these subtle reminders, like if you sleep wrong and have a crank in your neck, and then all of a sudden you can't rotate your head that direction, and it's like the worst 3 days because you can't move in that direction.
Yes.
So part of that is really important too. So a little bit of chiropractic care. It's not the only thing we do as functional neurologists. But it is a huge component of what we look at, because the better your spine moves, the better your brain is, the better functional independence you have.
Yes.
Very understated. So looking into that, we also do blood work.
Absolutely.
Your brain needs good substrates in your blood. So what is one of the things that I would say that you would tell someone if they're curious, okay, maybe I do want to be proactive with my health and start going once a year just to check baseline. What would you say blood work wise?
Well, the normal blood work that you've seen before, but to add in a few extra things, maybe some inflammatory markers.
Yeah.
That way we can look at your cardiovascular health, right? We can also look at other inflammatory markers, like joint markers, like uric acids, right? We want to see if the body is starting into a process. So that normal, CBC that you've had run tells us a little bit, but it doesn't tell us quite enough. Maybe your hormones. Most of us have heard of thyroid hormones, right? Oh, I get my thyroid hormone checked every year. But most people only do that if there's been a thyroid issue, right? Your other hormones, your reproductive hormones, those are important to know about as well, because without those, the brain doesn't function either.
Yeah.
Okay. So there's a lot that goes into just what we consider just a normal panel, and it's a little more than what you probably are getting if you're at a traditional office.
Yeah. And as it should be, really, because once again, it's not about competition. It's we need a big landscape to look at. because if we're going to make a referral or if we're going to understand how to lead a treatment plan or something for you, then we have to have a pretty good understanding as to how are all these things that interconnect with each other playing. How are they playing together?
Right.
So
and those things can sometimes tell us things that you wouldn't necessarily know.
Yep.
Like that lab work could tell us that you need to go see a dentist. Right?
Yeah. And we make a lot of dental referrals.
We do a lot of dental referrals. And so that lab work isn't just about your brain. It's about your brain and your body and how they interact. So it's incredibly important to, have those yearly brain checks, but that blood check too.
Yes, it's really important. And so I really want to drive this point home with some of you guys watching. We said this already, function precedes pathology. Right. So we don't really think day to day how maybe having a deficit in your ability to target different things or saccade or jump from target to target can actually make an impact on fatigue.
Right.
And can actually make an impact on your autonomic nervous system. Mm-hmm. And so one of the things that, this is my theories and stuff. I don't have anything written down. But as our sensory integration goes down and our brain doesn't know how to interpret what we see, what we smell, what we touch, then our autonomic nervous system, you guys may know it as your fight or flight or rest and digest, is your sympathetic and parasympathetic nervous system. It's responsible for output.
Right.
So if your input isn't good and you never check it,
right,
and your output isn't good, that will have a downstream effect on organ function. Mm-hmm. And so then we have our people that are like, if it's my thyroid. Mm-hmm. And that can be confusing for people that don't understand this concept, because they're like, well, what is the difference between a functional neurologist and like going somewhere else then, or a functional medicine practitioner? Because it seems like they all see anyone. At what point do I see my endocrinologist, and at what point do I see a functional practitioner?
Right.
And so we can work synergistically with some of those sensory inputs that are affecting how your autonomic nervous system has output and having that downstream effect on those other issues while synergistically working with an endocrinologist.
Right. And it's not always the things like, can I see and can I smell? Sometimes it's hyper.
Yep, like, too much.
Yes, absolutely. And that's just as much of a challenge for a lot of people because when you smell everything in the world, that's very unpleasant, right?
Yeah.
You learn that during pregnancy. So it's not always, for you guys to know, it's not always that something isn't functioning at all. Sometimes it's over-functioning. And, people come in here with hyperhidrosis. They're sweating all the time. Well, that's an autonomic nervous system function, right? Yeah. And so it's not always about necessarily needing a surgery to correct that. Sometimes it's about figuring out what's going on in the brain and correcting the signals in the brain to correct that. So there are a lot of different ways that, having these yearly checks and understanding what's going on in your brain will help you with some of these things that we hear a lot when people say, well, I didn't know that was connected. Yeah. Well, if it's in the body, it's connected to the brain. Again, we
all
don't,
of it.
We're not the end all. We don't fix everything, but we definitely, if you're here, we definitely know who to get you to if it's out of our abilities to help.
I'm gonna make you do some work, but there's a picture that I think is really eye-catching to people. It's when they get to see the brain and the nerves come out.
Yes.
And everything connect to that autonomic nervous system through the vagus nerve. And so if you get flash it right here, that would be fantastic because that is that for me, that was impactful when I first went to chiro. I was like, oh, that's all connected. And so if people can only visually see the actual physical connection, because it's not make-believe and it's not all hormonally and driven, although that's a huge connection, receptors are huge, there's an actual physical connection tying point A to point B.
Right.
And so that's super important. And the other quick point about the autonomic nervous system, online we see all the time, to regulate your nervous system. And there is a lot of truth to that. Mm-hmm. But that's the missing part of the sensory integration.
Right.
You have to go back to chain of command. And so a lot of people don't look into that. And that's where I would say that functional neurology is really special, is that we do really set ourselves apart in working in that sphere. And that's why we often get the compliment of like, wow, I have not had these results anywhere else.
Right.
It's not because, it's better. It's just with some of our training, I think we are told to look for those patterns in those sensory integrating models. So regulating that nervous system is great, but remember the autonomic nervous system is an output measure, not always an input.
Right.
So
That's good. That's a good point.